I do want to mention that from the standpoint of when we talk about this property tax cap, which originated, so don't throw things at me, it actually originated in the Assembly Republican Conference. However, when we said we wanted to have a property tax cap, we said we have to eliminate the unfunded mandates. And if you look at our proposals, not just on property tax cap and unfunded mandates, but anything that we touch upon in state government, we've got more great policies than I think any other conference in Albany. And if you don't believe it, you can look it up or just contact my office and we'll send you, because the binder is this thick of ideas that will improve New York State on every level. Now, one thing I'm going to share with you today, in prior ideas, we have said that we think it's a good idea for New York State to take over the entire cost of Medicaid. Our conference is going to be rolling out in the next 3 days, or next 30 days, a concrete proposal to do just that. And we're going to share it with both houses of the legislature and the governor. And our plan is upstate, 100% takeover by New York State over 10 years, 50% takeover of New York City over the next 20 years. These are big numbers, but they're affordable. We can do it, we must do it, and it's a comprehensive restructuring of the entire program. Because what I believe is once New York State takes over the total cost and you can reduce your property tax levies, then maybe New York State will do something about making the Medicaid program better, more efficient, more effective, and then also resulting in reduction of the cost of Medicaid rather than Medicaid continue to skyrocket in this state. So you will see an actual detailed plan and how to do it, how it's going to be paid for, the out years. It gets a little bit more difficult if you don't reduce costs. We have to reduce costs. We have to be more effective. And it's not about cutting and slashing services. I'm just going to share one story. I was in New York City last week, and I was talking to some folks that I know, and we're sitting around and having dinner, and one of the gentlemen I was with, his wife works in the healthcare field in the city. And she was saying that they have Medicaid patients that need public transportation or need transportation from their home to the healthcare facility for treatment and then go back home. Understandable. Medicaid coverage. But what Medicaid won't pay for is if they use a subway, a bus, or a taxi or Uber, Medicaid won't pay for it. But if they take a medical transport vehicle, such as an ambulance, Medicaid will pay for it. And this lady said they're very capable, they're physically able to take public transportation. They could use some help to pay for it, but you're talking about $20 cab ride versus $900 for a medical ambulance. That's precisely the type of waste of taxpayer dollars that runs rampant with this program. And it's not about the patient, it's about the administration of it.
There are a number of things that we've done to help counties, albeit imperfectly. I'm not going to stand here and say that we've done this, yeoman-like, crazy, great job, but I think we've done a number of things in recognition of the challenges that counties face. We are having a very intense, and I'm going to repeat, intense internal discussion between and amongst our members about what we should be doing on Medicaid. What do you do on long-term care? How do you support a system where basically 1/3 of our population is in the Medicaid system? And should that onus and that burden be on the counties? So we are literally, as I'm talking to you, we had discussions about this should the state be taking over the cost of that, which would be well over $2 billion to do so. All right, I'll come back and you can clap even louder when we get it done.